This is Ria and welcome to Narikaa Talk Show. Let's learn together and grow. And today it is a moment of extreme pleasure to welcome a very acclaimed doctor, Dr. Charulata Bapaye, who will answer some questions regarding today's topic, which is loss of the libido or sex drive. There must be many queries regarding today's topic. So before jumping to the questions directly, Doctor, would you like to share something about yourself with our viewers?
Thanks so much, Ria, for having me here. I am Dr. Charulata Bapaye. I'm a consultant gynecologist and endoscopic surgeon practicing in Pune for the last 25 years. I am also the chairperson of the Study on Female Breast Committee, FOXY. FOXY is our national organization of gynecologists. And yes, I think that I have a lot of experience and I could really share some of my thoughts, my views, and our viewers will definitely benefit from it.
All right. Thank you, Doctor. So, Doctor, at what moment would you say was the moment when you decided to become doctor?
Well, to tell you the truth, I don't quite remember any particular moment, but I had a neighbor where I lived in NCL colony, who used to always keep saying, Dr. Saiba to me. And it was as if, this person thought that I'm always going to be a doctor. And because of that, it just got inculcated in me that, yes, I just have to be a doctor. Besides, I grew up in NCL colony, as I was telling you, National Chemical Laboratory, where all were scientists and all the children of these scientists were all highly acclaimed people and all used to become either engineers or doctors. And so, it just went in the flow. And today I'm so happy that I was born and brought up in a place like National Chemical Laboratory, where academics was so much in the forefront that I felt that this was the path chosen for me, and I became a doctor. And as far as gynecology is concerned, well, everybody told me that it's a very, very hectic branch. It's a very busy branch, and you don't have any personal life. But I said, well, fair enough. I looked up to our doctor, Dr. Agashi Madam in NCL, who was the doctor of all the people in National Chemical Laboratory. And she is such a wonderful lady. And I just thought I should follow in her footsteps and become a gynecologist. So here I am with you on this talk show, thanks to being a doctor and thanks to being a gynecologist.
Thank you, Doctor. I'm sure that's very much interesting for our viewers to know. So moving on to our questions directly now. So, Doctor, our very first question for our viewers is, what is menopause?
Well, menopause is a very, very natural and physiological event, which is also called as the climacteric, which is the cessation or the stoppage of menses. The menses are the periods which are a woman's best friend, which come right from menarche, that is the start of menses, which can occur anywhere between 9 to 11 years nowadays, up to round about 50 to 51 years in the Indian settings, the periods are going on. But as the function of the ovary declines, as the ovary ages, the production of the hormone estrogen is going to really decrease. And once the estrogen level falls below a certain value, the eggs stop being produced and the woman reaches menopause. So when a woman does not get her periods for 12 months consecutively, we label it as a case of menopause, as a situation of menopause.
Moving on to our next question, Doctor. How does menopause affect sex drive?
Well, we just talked about nature deciding that now women do not need to bear children. And probably that is the reason why the sex drive is going to start declining. This is essentially because of a decrease in the hormone estrogen. That is one thing. Secondly, because of the decrease in estrogen, the vaginal moisture, the vaginal health, the vaginal rugosities all start decreasing, as a result of which sex can become painful, and that further causes a decrease in the libido or the sex drive. So declining levels of estrogen are the main cause of a decrease in the sex drive.
All right, Doctor. And Doctor, what happens to libido during menopause?
Well, just as we said that the libido is going to decrease. It doesn't occur to each and everybody, believe me, but most women are going to suffer from it. Some women, who realize that it is the brain who's the chief sexual organ. Okay. So what we think we are. So, there are women who say, what menopause? Where menopause? I'm not having any problem. And they can continue with a good sex life. But most women do suffer from a decreased libido because of decreased estrogen levels.
All right, doctor. Doctor, why does libido change around menopause?
So estrogen, and estrogen. This is the first answer that we will always give as to why libido changes because of falling levels of estrogen. Secondly, we realize that this is the time when, women suffer from some medical problems. Maybe they have some physical illness. Maybe they could be troubled by some cancerous problems. Maybe their relationship with their spouse, physically, mentally, is not good enough. Maybe there can be some financial stresses or some relationship stresses or some stresses in the family with the children. And that also contributes to a decrease in the libido.
All right, doctor. Doctor, does menopause lower sex drive in all women?
The answer is no. We just talked about the brain being the biggest sex organ. And women who say that, what menopause? How does it matter? My sex life is going to continue just like before. Well, they are the ones in whom the libido will not decrease to a great extent and their sex life can be just as great as it was before. But most women in our country would probably think that now I'm like 49, 50 and my kids are big enough and I don't really need any sex life and I'm not really interested in sex. And maybe there are some relationship problems with the partner. Maybe there are some financial stresses in the house. Or the woman could be suffering from some physical problems herself. There could be financial issues, there could be health issues. And these are the women who have noticed a decrease in the libido, definitely. But those women who are enjoying a good sex life before, who are very, positive towards sex, well, they do not experience a decrease in the libido.
Yes, doctor. And doctor, what can be done to treat vaginal dryness during menopause?
We just mentioned that a decrease in the level of the estrogen can cause a decrease in the health of the vagina, like the vaginal wall starts thinning, there is less secretion, there is less lubrication, there is it takes more time to get aroused. The clitoris also reacts very slowly because even the neurological problems start setting in now. So to overcome this vaginal dryness which sets in, there are a number of things that can be done. First and foremost is you have to prolong the foreplay. Okay. If the couple spends more time with each other before the actual penetration, then also the vaginal lubrication is going to increase and improve. And secondly, and most importantly, there are a number of medications which are available today in the market which can help vaginal lubrication. It could be something like simple Vaseline or some moisturizing agent, but there are some specifically designed jellies which could be water based or silicone based, which when applied just before intercourse can reduce the dryness. At times, there are some hormonal creams also available which can be used vaginally, which can improve the vaginal health and improve the lubrication. So this is what we definitely recommend to our patients or viewers who wish to overcome vaginal dryness.
Yes, doctor. Doctor, which physical changes affect sex organs?
It is the falling estrogen which is going to, cause a number of changes in the sex organs. Okay. So the sex organs, the primary sex organs are the uterus, the vagina, the introitus, that is the opening of the vagina, and of course the breasts also. We know that the breasts are also a secondary reproductive organ. So as far as the vagina is concerned, we talked about the thinning of the vaginal wall and the dryness out there, but even the introitus, that is the point of entry into the vagina, that also shrinks to some extent. Okay. And some women can develop cuts out there, the penetration becomes difficult at that particular area. So these are the main changes in the vagina and the uterus, which cause a decreased, desire for sex because it becomes very painful. And as far as the breasts are concerned, the breasts, which were once upon a time firm and extremely sensitive to touch and were a pleasurable organ, well, the nipples, which were otherwise very pleasurable to touch, the pleasure part goes down, the breast starts sagging, and the pleasure which comes because of stimulation of the breast, the woman no longer feels these pleasurable sensations, or it takes time for her to feel these pleasurable sensations.
Right. Doctor, can supplements help with libido around menopause?
Well, supplements, we are talking about, say, calcium or multivitamins. And the third supplement which we could talk, which cannot call it a supplement probably, is the hormone replacement therapy. So as far as vitamins and minerals are concerned, yes, it can definitely help you because it makes you feel good, it makes you feel fit, and it can, definitely give you a positive feeling towards menopause. And any kind of positivity is good positivity, so that can definitely help. Second is about the medication, which is the hormone replacement therapy. It has been seen that when we give, we've just talked about estrogen being very low, which causes all these libido problems or menopausal symptoms. So if we supplement estrogen, sometimes along with testosterone, sometimes along with progesterone for safety purpose, it has been seen to increase the libido to some extent, but not to a complete extent. So yes, some kind of medications can definitely help to increase libido.
So it's time for a short break now. We'll all see you in next few minutes. Welcome back to Narikaa Talk Show again. Moving on to our next question. And doctor, how can one improve intimacy with their partner?
This is a very good question, Ria. I think intimacy is probably the most important key to a very good married life, a successful married life, whether it is in menopause, before menopause, after menopause. Because the bond that is between both of you is so important, which rests on trust, it rests on happiness, it rests on a bond between both of you. And when menopause comes, maybe the couple, if they desire a good sex life, they could be together, they could watch maybe some porn or maybe some videos which are stimulating. They can read books or magazines which talk about sex, and they can bond together even better because of that. A lot of foreplay, if actual penetration is painful, that also can really increase the intimacy between the couple. And I think most important is having a clean, happy relationship, which is based mainly on friendship, that will take them ahead through menopause and post-menopause.
All right, doctor. So, doctor, how can one prevent from STD?
A good question there, Ria. The point is that one feels that STD is a disease only of the youth or of adolescent, but that's not true. It can affect you even during the perimenopause and the menopausal time period. And that's why adequate protection is definitely a must. STD is sexually transmitted diseases. Okay. So if you're having multiple partners, or if your partner has some disease which can get transmitted through sexual activity, then it can definitely come to you even during menopause and post-menopause. One more thing we need to realize is that as we age, our immunity is going to decrease. And as a result of which, we are going to be able to catch this disease even more fast. Secondly, is that the vagina is going to be thinner than earlier. It is going to be more weak and more vulnerable to infection than before. As a result of which, you are definitely prone to catch STDs even in the time period of 50 plus. So in the US, there is a very large population, who are 50 plus and who are HIV positive, essentially because they probably don't take adequate precautions. So I think using a condom during sexual activity is usually a good idea to protect yourself from sexually transmitted diseases. And going for a checkup to your doctor, if you notice any symptoms of itching, dryness, excessive rashes, or any kind of discharge, foul smelling, non-foul smelling, please get it checked from your doctor.
Doctor, is the loss of sex drive normal as men get older?
Well, most men think that they are immune to any kind of andropause, but that is not necessarily true. As men age, their sex drive also decreases, but in a very small way as compared to women. So there is maybe a 5 to 10% decrease in their sex drive as they cross, 45 and 55 and 65. But most men do have a reasonably good sex drive even beyond 70. So yes, they do suffer from a bit of loss of libido, a little bit of loss of erection, a little bit of delay in getting satisfaction, but it is much less as compared to women.
All right, doctor. And doctor, which lifestyle strategies can help increase libido?
Okay, so lifestyle changes like maintaining a good sex life even before menopause, like those couples which are really active in their sex life before menopause have been shown to enjoy a good sex life even after menopause. So, as we say that start early, here too the answer is start a good sex life early. Secondly is maintain good health. Unless you are physically and mentally fit, you are not going to be able to enjoy a good sex life. People who suffer from conditions like depression, they are given medications which can hamper your libido. So, if you're physically and mentally fit, you're going to be able to enjoy a good sex life throughout. Then, thirdly, a good relationship with your spouse, which is based on trust, which is based on intimacy, which is based on happiness, which is based on sharing and caring. And, that will definitely take you through and keep your libido high. Problems like stress, problems like discord in the family, these are going to affect your sex life. So try to keep them to a minimum. Let the kids lead their life, you lead your life. These are just a few, what do you say, tips that I would give to any couple so that they can have a good sex life. And most importantly, don't feel shy about being sexually active even beyond 50, 55, 60. There are times when, oh, she's 65 and she's still sexually active. What must she be doing? This is what could be the reaction of most people. So don't feel shy. So what if your kids are older? So what if you are aging? If you'll enjoy a good romp in the bed, go ahead.
Yes. And doctor, how can a person foster a sense of intimacy with their partner?
Intimacy is all about how you have connected at the level of the mind, because as you age, the physical attraction is going to be less as compared to what it was when you are 20 and 30. So now only when the minds connect, when your neurons are together, when you are on the same page as far as life is concerned, that is how your intimacy is going to be good. Again, as we said, spend more time with each other. We are seeing everybody's having such busy lives today. They hardly have time to speak with each other, leave alone, being intimate in bed. So, try to reach home early. Try to please your spouse with a candlelight dinner. Get flowers for him or her. Get a surprise gift for them. Keep the magic going. It's not going to be a one-day thing. Just make sure that you are together physically and mentally, and try to please each other, not only in bed, but otherwise also. Try to do things which your spouse likes, and that will take you a long way as far as intimacy is concerned.
And doctor, which natural remedies can help increase libido around?
Oh, well, a good massage is something that I would definitely suggest. So these are natural methods like, you do get some creams which they claim to, arouse your partner. They claim there are medications to arouse libido, especially for the men. As far as women are concerned, there are, medications don't usually help much, but a good massage by your partner. Secondly, clitoral stimulation. So clitoral stimulation with some creams which are supposed to increase the blood supply to the clitoris can also, increase the libido naturally. Then there are some vibrators which you can get, which you can use for the clitoris, which you can use for the vagina, which can stimulate you better. And I think that these are some natural methods which I can think of. And of course, which we talked about, increasing foreplay. This also can definitely be a natural method to increase the sex drive, the libido, and the actual sexual act.
What is the best time to see a doctor?
Okay. Well, in my opinion, the best time to see a doctor is when nothing is happening to you. That means we have to attend what is called as a well woman clinic. In our country, there is no concept of a well woman clinic. People think that they have to visit a doctor only when something is happening to them. But if you attend, if you visit your gynecologist or your family doctor, maybe when nothing is happening to you, with every passing year, your doctor is your best friend. Your doctor can identify small changes that are occurring in your health, physical, mental, psychological, and they can guide you better. So rather than visiting them when something is happening to you, if you meet them before itself, they can guide you better. If you realize that your sex drive is decreasing, or if you're having dryness of the vagina is setting in, or your perimenopause is setting in, please visit them at that time so that they can help you better. Secondly, of course, if you start noticing redness of the vagina, very severe itching, infections, or some kind of discharge coming from the vagina, or some growth around your vagina, some warts at the level of your vagina, of course, you're going to visit them. But I think that to enjoy a good life overall, we must promote Well Women Clinic, wherein women visit their doctor even when nothing is happening to them, so that their doctor can guide them as to how they can lead a happier and healthier life.
Thank you, doctor, for sharing your informative views on it. And I hope this session was really beneficial for all the viewers out there. So before leaving, doctor, is there anything else that you would like to share with our viewers?
Well, I believe live life queen size. You are a queen in your own way. We are all stardust. We are all stars. We are all going to shine. So make the most of this one life that has been given to us. Treat your body like a temple. Keep it beautiful, keep it clean, keep it happy. And there is no end to what you can achieve as a human being, whether it is with your own body, whether it is with your relations, whether it is with your spouse, with your children, whether it is in your career. So, best wishes to all our viewers and wishes that they have a happy, healthy, and sexful life. Thank you.
Thank you, doctor. Well, doctor, that was really a great response, and it means really a lot to us to be with you in Narikaa Talk Show. And thanks a lot for taking out your precious time.
Thank you so much.
So, guys, we will meet you in the next session with another exciting topic. Till then, to all the lovely viewers, stay tuned, stay happy, and stay safe.